Once again, we welcome you to Coffee Break. This, of course, happens Monday, Tuesday, Thursday, and Friday at this very time, after issues at hand, at 10 a.m. And of course, every Tuesday, we are talking health. And of course, together with specialists from Mengo Hospital. Now today we are talking about something very, very important. Of course, when we were growing up, these were rare cases, but these days they are so rampant. And of course, as we shall see the prevalence, but of course we are talking about short-sightedness among children. Now this is if it is not yet if you've not yet diagnosed it, or if they have not yet diagnosed it with your child, it doesn't mean that it doesn't happen the next day. So this is something very, very pertinent, and we need to pay attention to. Therefore, we welcome you to this program, of course, in partnership with Mengo Hospital, and with us is Nicholas Kagumba Musisi, who is an optometrist from Mengo Hospital. It's a pleasure having you this morning.
Thank you so much.
We are delighted.
I'm happy to be here.
Yeah, good morning.
Good morning to you.
How is Mengo?
Mengo is okay, and we are actually doing our best to bring the best to the patients.
This is very interesting.
Yes.
Kindly greet our viewer, and then we shall get into our conversation.
Good morning, everyone. My name is Kagumba Nicholas Musisi. I'm an optometrist. I work with eye department, optometry unit in Mengo Hospital. I'm happy to be here. I'm happy to be in Family TV studio. Yeah. We're
also happy to have you. Now, if we start off, of course, with what we want to look at, that is short-sightedness. If you can broadly break it down for us, and then we shall relate it to the children, because that is where our center of discussion is.
Yes, generally speaking, for someone to see well, light is supposed to come from one object they are looking at, to pass through the front layers of the eye to the back of the eye, where that message is sent to the brain so that you can see well. But at times, that light is not focused at the back of the eye very well for some reason, one reason or the other. For people who are short-sighted, their eyeball is either long, or that front surface of the eye, called the cornea, is too curved. So in that case, light is formed in front of that part, retina. In front of the retina. Retina is that sensitive part is supposed to send a message to the brain, so that you know that you need to see something. So if light is formed in front of the retina, you cannot see well. So either that someone has to come close to an object, or they have to strain their eyes so much. So that's what we call short-sightedness. So people with short-sightedness, if you can allow me to tell them the symptoms.
Before you get into the symptoms, okay, I think it's still in line with the symptoms. But we've seen people who, when they're reading something, then they have to do this. And then we've also seen others who put something long like this for them to read. So what is the difference?
Actually, people who are short-sighted, they bring their things too close.
Too close? Yes, so people who read like this are
yes.
Short-sighted?
Actually, those who put far, those who are a bit elderly, adults, for them, that concept called presbyopia, it comes with age normally. Those who push their things far. But those who see closer and those who are short-sighted, they can see closer things, but they cannot see far things very well.
Now, of course, tell us the symptoms, especially in adults, that people can look out for.
Let me start with the children, because that's what yes.
Okay, as we get to the children, before we you've talked about the science that brings about this. Yes. And when we look at the children, is it the same science that happens, or for the children it's a little different?
Actually, it's the same science happening. It's the same science happening for all of us. Actually, the basic thing, you cannot see far very well. So can you see certain things that far very well? You either have to come closer to it, or you have to strain your eyes. And you strain the eyes, the other symptoms you can get. People can get headaches. Apart from not seeing far very well, you can get headache. The eyes can get strained. Other people can get light sensitive. Whenever they look at some light, they feel they want to close their eyes. Then the squinting of the eyes, try to make their eyes smaller so they can try to see. Those are the main symptoms. Then for children, if you're not very keen as a parent, especially those of us who work in the offices, we don't have time for our children. We leave very early in the morning, then you come back at night when the child is asleep. But ideally, if you look keenly, you see your child for them to touch something, to get very close to it. Or if they're watching TV, you see them getting close to the TV. Sometimes even parents complain, my child always gets close to the TV. It has bad manners, but they're not bad manners. They're not seeing whatever they are looking at. They have to first get closer to the what? To what they are supposed to see.
Actually, when you talk about that, I think it happens that we see very many children, they come and sit just immediately close to the TV. And some parents are like, oh, you're what? And they take it lightly.
Yeah, actually, I need to be concerned. Until you take them for checkup, don't take it lightly. So they have to take them for checkup to rule out the short-sightedness.
How is headache connected to short-sightedness?
One of the eye is one of the organs which is very close to the brain. So, actually, if you talk about the sensory organs, eye is one of the closest to the brain. So, and also because we have the muscles which are supposed to move the eye left, right, and all that. But also some of those muscles are used to focus. So as try to strain your eye to see, those muscles are strained. And whenever there's kind of pain around the eye, it can manifest to the entire head. Yes.
Now, of course, a child, a parent has seen some of these signs. We've also, like you talked about squinting the eyes, and then someone is, and then there's also something that happens, especially when someone has been in like this light here, and then they step out in the sunshine, and then you'll see them trying to fold their eyes a little. Is it also related to this?
That one, it's not directly related to it, because sometimes there are many other causes, because can also, the other conditions can bring light sensitivity, but if you have that kind of feeling, it's better you have some kind of checkup so that we rule out what's causing it.
Well, now we talk about the prevalence, because like we said, sometimes it might look far from you simply because you don't know about the numbers, you don't know about who is, how many people have this. And now you people who are at the helm of these cases, how is the prevalence of this? Should I call it a condition or?
It's a condition,
okay.
Yeah. So people who are short-sighted, actually the statistics are so many globally, but around our country, they're not that many. I think the reason is because eye care workers have been very few and been focusing on treating patients. Working with patients, they have time to really do other things other than seeing patients. However, from the research which was done in 2002, it says that 11.2% of people who have sight defects are short-sighted. By the recent study which was done in 2024 in Mbarara University students, it found that 60% of people who have sight defects are short-sighted. But then globally, it says, according to the global statistics, about 30% of the population are short-sighted. And in 2050, about 50% of the population will be short-sighted in case right things are not done. Otherwise, there are things which can be done, but if they're not done, about 50% of the population will be short-sighted. So it is really rampant, and you need to do something about it.
And that is scary, especially if you said there are certain things that are supposed to be done, and if they're not done, then we need to, but we shall get to that later. Let's now look at the risk factors. What brings about this, or what triggers this short-sightedness?
Yes, that's very important. So one thing is the genetics. Some people are naturally predisposed because of their genetic makeup. So there are those in the families who really, in their families, short-sightedness is just following them. And that one is there, and there's nothing much you can do about it. For example, in case in your family, maybe the parents are both short-sighted, chances are about 50% of you giving birth to a child who is short-sighted. But in case one of the parents is short-sighted, the chances are about 33% for it to have to be short-sighted. So, having a family history of short-sightedness predisposes you to short-sightedness. The another thing is, I'm not talking about things which can modify the time spent on screen, tablets, phones. Especially, I'm talking about children specifically. Yes. Yeah, this time is actually that time we spend on those digital screens can predispose us to getting short-sighted. So ideally, a child below 2 years is not supposed to see any screen, whether tablets, whether phone, what. You need to spend 0 hours per day on the screen if you have a child of that.
A child below 2 years?
Yes.
But now it's different on ground, if I can borrow that word.
Yes.
On ground it is different. A child of 1 year has even games or cartoons that a parent give them to watch.
Yeah, but that's not okay. Especially, it's not okay. That's why you need to go back to that traditional way of parenting. The child either is with you as a parent, or maybe the caretaker, or with other children trying to do other activities, but not on the screen. But then those children between 2 to 6 years, we allow them. We need to allow them to use at least a maximum of 1 hour on the screen per day. Yeah. So now these days things have changed. Children start to go to school early, maybe at around 3 years of age. So when you're talking about these 2 hours per day, we are not talking about the time they use that tablet for school. Because some schools use tablets for schooling. Yes. You're looking at this time they spend recreation time, they are free, all those things, especially when they're at home. That's when we're talking about those hours. Because now studying has shifted from these normal physical things. There's now
our old traditional way.
It's now digital, everything is digital. Yeah. So at least when we're looking at this time, which we can modify, which we have control over as parents, at least 1 hour for children between 2 to 6 hours, for 2 to 6 years. Then from 7 to about 16, maximum 2 hours. So parents have work to do, and the caretakers of children, because you have to regulate the time they spend on that, on those tablets, on those phones, and all those things they use to play and all that. I was told there are some apps which can be put in the phones or tablets, which keep monitoring the time the child has spent on those tablets you buy for them. So you can utilize them. They're very important.
Okay.
Yeah. So ideally, but if in case we don't do that, we're expecting much more number of children to be short-sighted. If we don't do that, and those who are already short-sighted, in case they keep using those digital screen more time, their rate of short-sightedness increases. Someone who was finding hardship in seeing at 60 meters, at time will reach, and they find it hard even to start 2 meters. So we have to be very cautious about the time our children spend on the screen. Okay. Then about the adults, for you, we assume you are old enough and you can have breaks in between as using your screen. So recommend for every 20 minutes of computer use or phone use, whatever, as long as it's a digital screen, have a 20 seconds break, as look at something very far from you. 20 minutes of computer work, have 20 seconds break, as look at something very far from you. That helps your eyes to relax a bit as you do that.
Okay. We are looking at the risk factors, and those were actually 2 that you had given us. We can continue with the other risk factors that are associated with the short-sightedness. Yeah,
another thing which is related to time spent on the digital screen is the time spent indoor. These days we are in the era where we are very insecure. I don't know whether it's insecure. We want our kids always to be inside the house. We don't want them to be out. But idea that's a risk factor actually for short-sightedness. Children need to spend minimally 2 hours outside the house, not in the shade, outside, not necessarily outside the gate, but it's where they can get natural light. Yes, natural light reaching them. When there is, so we need about 2 to 6 hours for children to be outside. So I know in school it's a bit hard to manage, but when children are on the holiday, they are over there over the weekend at home, please make sure they have some time outdoor. And make sure the children get interested in these games, which requires them to be outdoor. These games on the phones, all the time, the games on the tablets, we don't recommend them so much. Yeah. So I think there's some sort I was trying to follow, and they say that keeping your child indoor for an additional hour. Okay, sorry for lack of a better word, but for as long as don't take your child outside, you are increasing the risk of having your child get short-sighted by 2 times. That's one of the studies. But there was many studies, and the studies are not really consistent. But one thing we know is that natural light you get from outside is very important to stimulate someone to see well and to minimize that of myopia. Well,
still talking about this now. there's been a concern when people come for diagnosis in the hospital. You tell them cover your eye, and then you tell them to read. Bigger letters, smaller letters. I mean, the fonts, different fonts, and it's a little disturbing. It's a little, So a parent would really want. So when I bring my child, I've identified some symptoms that we talked about earlier, and I've come with my child to the clinic.
Yes.
What do I expect?
What do you expect?
Yes. I expect. Do I expect you to tell my child, cover your left eye, then read this?
One thing is when you go to hospital, eye clinics, which are really of quality, they have different charts for different levels or different ages. There are tests which we can do, and we don't involve anyone to read. So those who are below 2 years, below 4 years, they cannot literally read nothing. But also we also look at, there are those who are in school, they know how to match. Can match an apple with an apple. Show them an apple, they match. So we have different tests we do for different age groups. Yes. So it's not like one thing for every age group. Yes.
Okay. Now, of course, the other thing, besides the risk factors, now the big question is management. If my child already has myopia, how do I manage this, and how do you treat it? Are there chances that it heals? Is it a condition that they live with? We only manage it, or?
Yeah, thank you so much. That is a very good question. It's always a concern by the parents. So normally when you bring your child to the hospital, they do all those assessments to know, and if they find out that your child is short-sighted, we want them to help them see well. And there are several management procedures. One, sometimes uses devices. One of them is glasses. Glasses is one of the thing which normally used to correct short-sightedness, because they are less invasive and they are not as expensive as some of the other techniques we use. There's something called contact lenses. There you get some kind of a lens which you put directly to the eye, and no one will know that you have the glasses. However, it requires some precaution as using them. There are a lot of do's and don'ts as using them. So if the child or any human being is able to follow those rules, we recommend them and they use them.
So are they put there permanently, or when I'm going to sleep, or when a child is going to sleep, the parent removes them and then they reinsert them?
Actually, we normally use them for day. During that day, don't use them at night. When someone's going to sleep, they remove them, they clean them, and then in the morning you clean them, then you put them on. Yeah, those I said, those some of the do's and don'ts. Otherwise, if you sleep in them, there are risks of getting infection for your eyes. So those are very important issues. So you first monitor as you come to ask for them. We really ask all those questions. Are you able? And also try to follow up. Then when you come back and you come with an infection, we don't give them back to you, even if you want them, because we don't want to lose your eyes.
Okay. Which other management and treatment modules are there?
Other treatment modules, there is also what you call surgery. There's some surgery which are done to shape the front part of the eye, we call the cornea. Because as I mentioned, short-sightedness comes when that front surface is either too curved or the eyeball itself is too long. So when it's too curved, there is a method the surgeon may use to reshape that cornea to a level that light is focused at the back of the eye very well for someone to see.
Isn't this risky?
Yeah. For any kind of surgery, because there are some risks, and also it may not apply for everyone. Yeah, because ideally, when someone is still growing, even if you reshape, after 1 year or 2 years,
it will grow again. So we normally recommend that one normally from age of mid-20s, 25 onwards. But for children, they have a higher rate of growth, and the growth is not limited to some parts of the body. All the parts of the body grows. Yes. So ideally, the most convenient for children would be the glasses, or probably contact lenses, depending on how people are able to take care of them. So the question is, when all this, for example, if you give me the contact lens or the glasses, is there hope that I'll regain my natural sight without any aid? Or the moment this condition comes, it has come, and I'll live for it for the rest of my life.
So the number one thing,
I put myself in the feet of a child.
Yes. The number one thing is those sight defects depend on the shape of the eye, and as we are growing, the shape of the eye can keep on changing. But for people who are short-sighted, most times what we expect is the eye to get either bigger or wider, because we are growing bigger and the size is increasing. So chances are high the short-sightedness will increase. But there are those rare cases where it keeps on reducing. So there are those cases where the short-sightedness can go away, someone who goes back, and the higher chances is to progress or to remain the same. So one thing is we recommend the reviews. For children, you can have 6-month review or 1 yearly reviews. Depending on what the doctor will tell you, they will see your condition, they will assess. Sometimes they will come after 6 months, sometimes they tell you after 1 year. So they will assess and see. That's why you recommend them to come, because these children keep growing and they grow very fast. So if someone was using a lower power, maybe for example -1, after 1 year things might have changed. Maybe they need 1.5, at times they need 0.5. So between that time, need to really assess and give the child what they need to see well. So your question is, there is a possibility of you regaining your sight without any aid, but we cannot guarantee.
Okay. Now, since, of course, you gave us a few preventive measures, but I think prevention is better than cure. So what else can parents do besides monitoring the screen time? Because there is a parent who says, I've done everything. I've monitored the screen time, I've done this, I've taken my child outdoor, but still their children are diagnosed with this condition, or this defect. What can a parent do to prevent this? As
I mentioned earlier, there are things we really don't have control, especially the genetics. If you are genetically predisposed, I mean, nothing you can do about it. But one thing is, we want to prevent myopia progression. If you come to my clinic and you have a low power, for example, -1, you don't want to come after 2 years and you have -5. So doctors have really focused on preventing myopia progression. And you as a parent, what you can do is the things I talked about earlier. Make sure your children doesn't spend a lot of time on the screen. That's number one. Actually, regulate the time they spend as they're using the screen. Number 2, make sure the children have time to engage with other children. As I mentioned, these days we have, I don't know, the insecure, we don't trust our neighbors at times, but we need to really come to that traditional way of bringing up our children. Because as children interact with their colleagues, they may not have time to think about the tab you gave them. Yeah. So if you think you have issue with your neighbor, over the weekend take them away to places which are child friendly, where they engage with their colleagues. Maybe to take them to see uncles' children. They play together. That's one of the main things parents can do. Another thing is bring them for examination. Every parent, you need to bring your child for checkup at least before they go to school. But also, if you recognize any symptom, your child is looking at something, they have to get closer to it. They are squinting to see something, take them to hospital straight away. But if you don't do that, then you recognize it later. Sometimes things may require higher level of management. At times, even the results may not be as good as you would get in case they are managed early. Yes.
So, is there any chance that some of these, these defects are associated with diet?
Diet, that is very important for the eye health, but they don't affect the shape of the eye. Yeah, they don't affect the shape of the eye. Because if you have a very good diet, there are some diseases of the eye you may not be able to get. Yeah, and one thing I need to inform the public is that you being short-sighted doesn't prevent you from getting allergy, doesn't prevent you from getting infection, doesn't prevent you from getting pressures of the eye and all that. So what I mean is, if you eat very well, your macula, all the parts of the eye most times they remain intact, and your immunity towards some infection will be very good. But in terms of those sight defects, what you eat doesn't really affect.
So even if, because we've seen people tell us eat a lot of things with carotene and what, they're good for the eye. And people have these defects or they have this condition and they keep on eating this naturally, thinking that maybe it can be of help.
One thing is, I know that vitamin, those carrots, food rich in that vitamin A and all that, they are really very important for our eyes. But whatever it is, too much of anything is always bad. Too much of anything is always bad. Just have the right, take the right quantities. And as I mentioned earlier, those carrots, and they have nothing to do with short-sightedness. And no one should lie to you. Those food supplements, I know they're out of advert somewhere, and they talk about this food supplement, take away the short-sightedness. That's not true. And ideally, if someone will eat your money, then at the end of the day, someone won't see well. Your child won't see well. So make sure that when someone is short-sighted, bring them to the hospital. We shall do what's necessary. But eating, diet, that is important. You recommend to have a good diet, but not to make sure that that short-sightedness goes away.
There are also people who use natural remedies. They tell you when you use this concoction and then you cleanse your eyes in the every morning, then you'll be better.
Actually, those are some of the myths. Sometimes the people mislead us. And some of those natural concoction, they may contain some bacteria, some of the germs. Put them on your eye, actually your chances of infecting your eyes increase. So which I really don't recommend them. Actually, our eyes are very important. Everyone needs to this beautiful world. So otherwise, don't just play with them. Don't use anything on your eyes. Seek advice from the qualified people.
So what happens if I don't manage this condition in time? Can it lead me to blindness?
Thank you so much. That's very true. If you don't manage the short-sightedness in time, you can become blind. And one thing I mentioned earlier is called myopia progression. As the levels of myopia increases, or the level of short-sightedness increases, there are chances that short-sightedness can damage the back layer of the eye, which is called the retina. Something called retinal detachment. Some people even get the pressures of the eye, which is called glaucoma. So those diseases are largely irreversible, and they are blinding diseases or blinding conditions. So it's better that you bring them to the hospital so that we can really help them to see well, but also make sure we help them to minimize the rate of progression of that short-sightedness. The another issue is if the child is short-sighted, especially if they are highly short-sighted and they're still young, and nothing is done about it up to the age of about maybe 6 to 10. Later in life, even if they want to deal with the short-sightedness to see well, they may not be able to see well. There's something called lazy eyes. So when the eyes are not supported to see well when they are still young, they get lazy. There's time when if you give them glasses or do the surgery, the vision cannot get better. That's what we call lazy eyes. And in that case, a child is really cannot enjoy the world we are living in. They cannot study very well, all that. So in other words, we need to check our children as early as possible. Make sure we follow up the reviews the doctors give us, but we don't teach to that level of lazy eyes. Otherwise, it's a bad condition. Of course, in Mengo, if your eyes are lazy, there are things we can do for you to support your child, to support you, that you can try to live as other people. But you don't want to reach that level. Yes.
So are there any other diseases that are associated with short-sightedness that are maybe this myopia is caused by disease A or B or C? Because this is also another this is some information out there in public that someone will tell you, oh, they're like that because maybe have they gotten this particular condition before? I mean, and so a parent says, nzo mwana wange amaso galiko gati kubanga yarwala, for example, measles, and you know, parents believe it is that, and that is why they become reluctant to visiting clinics.
Actually, it's a very good question. Let me start with the conditions which are associated with short-sightedness. People who are born with albinism, most of them are short-sighted, so need to bring them to the eye clinic as soon as possible, and we assess them and we help them to really see better. Those who are short-sighted, and also we have cases of those who have had cataract. Cataract is we have a lens in the eye. When it gets when it gets opaque or translucent, something like that, so whereby someone isn't able to see. At times when they remove that cataract, someone may get some short-sightedness. Yes, those are the very common ones, but of course there are others. But also in case your child is not seeing well, even those children who have diabetes these days, so you have diabetes, at times your vision is not very stable. Sometimes you are short-sighted, next day you are long-sighted. So some of those diseases are associated with those sight defects. So as you are saying, your physician so come to the eye clinic and we assess the eyes, so that we support.
Okay. So for example, the dentist will say that at least visit a dental clinic after 6 months. How often should someone visit an eye clinic, even when they don't have any problem?
We recommend a yearly checkup for everyone. However, in case your doctor recommends, please come back after 6 months. Don't say like the other Musa on the TV.
Yes, said
after 1 year. So the doctor would assess. If says they come after 6 months, please come after 6 months. First, have come after 3 months because they have seen something which may require to be followed up on that. But normally, 1 year we need to have a review and we check your eyes and see how they are doing.
Yeah. So meaning on a normal scale, every after a year you should visit an eye clinic.
Yes, if everything is okay, come and you say an eye doctor to see you. But if you see something not happening very well, please come as soon as you see that anomaly in your eye.
Then this is also a very common concern or question out there among the people, especially with glasses. Do glasses expire? Because we've had parents say, ezo galubindi zaggwako ayina okufuna endala. That's the common statement they normally use. So do they have an expiry date that you'll wear them for 3 years and then after 3 years you switch and get more, or do you advance them according to the problem? I don't know what happens.
Yeah, thank you so much for that question. It's a very good concern because I'm saying your glasses expire very fast.
Yes.
So ideally, as I mentioned earlier, these sight defects, the short-sightedness, even these are the one, the long-sightedness and others, they come depending on the shape of your eye. But as someone is growing, especially children, all of us actually, as we're growing, the shape and the size of our eyes keep on changing. So there, when you measure the powers, chances are high after 1 year or after 6 months, depending on the individual, the powers might have changed. So the power of the glass are the same in the spectacles we gave you, but what the eyes need for you to see well has changed. So normally I would say it's our eyes which keep changing, but the glasses don't change the powers. However, these glasses are manufactured like any other thing which are manufactured. They can get scratched. So if they are scratched or they are deformed, because we have to change them. Yeah, but really there's no specific maybe expiry date for them. if you take good care of them and your eyes have not changed, you can use them for as long as it's possible.
So what is the science behind you recommending glasses? Because we've seen hawkers in tax parks and on streets selling glasses for short-sightedness and glasses for long-sightedness. But what is the danger in buying them? Because very many people buy them and cheaply. Someone say, when I go to Mengo, they're a little expensive, yet these ones are cheaper. Let me buy this, let me go with this cheaper option. So what is the whole science around getting these glasses from a specialist?
Yes, thank you so much. So our glasses are not like clothes, just trying and you put
and you take.
Yes. We do specific tests which they pass to find the right powers for your eyes. And also even the frames where those lenses are put, they have different sizes. We want to get you something which is very okay for your body, for your head shape and the shape of your face. So in case you just buy the glasses from the hawkers, chances are high you get the powers which are not the right one for your eyes. So one thing will happen, you strain your eyes, others will get headache, then you'll not be comfortable. At times even you don't see well actually. Some people even put the both glasses, but they made them to see worse. So which I recommend you get them from qualified people so that you get the right thing. Another thing is when you get glasses from qualified clinics or hospitals, when you have an issue, you can easily go back and let them know, you know what, I got these glasses, this and this happened. They'll do the investigation and they find out what caused the problem and they rectify it. But this Oka, you've seen him today, you want to be able to see them after 2 days.
Yeah.
So you have your
They have shifted. They are now in Natete Tax Park.
Those things. So you die with your problems. So that's why I would recommend to really visit places which are genuine, like Mengo Hospital, so that we get the right services.
So of recent, Mengo launched a very specialized eye unit. And when does it work? Does it have specific days that it is closed so that someone can visit on those particular days when it's open? All and what is your time of operation?
Actually, that specialized unit is working from 8 to 5 on Monday to Friday, then from 8 to 2 on Saturday. So now that the patient can come in within that time. But also you have emergencies. There are always doctors there to work on emergencies. So you can
even when it is closed on a Sunday.
Yes,
as long as it's an emergency.
It's an emergency. There's some doctor who is there to cover those emergencies. Yeah.
Okay. So a patient can, we don't want to say patients, but you can visit. You can visit the facility. Actually, some people are not be knowing where this specialized unit we are talking about is located. So kindly direct them because it's not in the main entrance. So I mean, you can reach, but I think it's a little far when you use the main entrance of the hospital. It has another entrance, easier entrance.
Okay, there's if you use if someone knows in Deje University, just opposite in Deje, that's where the complex is. But when you use the main gate, there are always people to support you to reach there. So if you reach Mengo Hospital, you cannot get lost. Okay. Yes.
Well, give us your closing remarks as we wind up with this discussion, and maybe a caution to our parents out there, especially with children, because increasingly we are seeing children with glasses. This was a rare thing when we were growing up. At least you would find children, I mean, at secondary level, A level. But these days, as early as P2, P3, children have glasses already.
Yeah, thank you so much. Actually, we have people who are 2-3 years and they have glasses. Oh. Yeah, we see them in Mengo. So one thing is, have your child checked as soon as it's possible. Let's make sure that you take them to checkup before they go to school. And if you see any symptom, take your child to the hospital. Another thing maybe I would like to emphasize is we need to regulate the time we give our children, because you realize instead of we've left the parenting to our tablets. So when a child is crying, give them a tablet. Don't want to take the time to understand why they are crying, why they are doing what. So regulate the time children spend on their tablet, on their phone, and also allow them to have some time outdoor. That's very, very, very important. There's something I needed to talk about. Yes, I don't know what you think about. I'm not a marriage counselor, but as I gave you the statistics, if two parents are short-sighted, they have 50 chances of giving birth to a child who is short-sighted. Just to give you something to think about. What if you are short-sighted, you look for someone who is not short-sighted? So that we try to minimize these prevalences of short-sightedness. That's the genetic
aspect you talked about.
Yes, try to think about how can you modify. Yeah, but of course, sometimes love surpasses everything. But I think about it. Those who are not yet married.
Thank you so much. That is actually a very good food for thought. I believe that especially Esther has had that. But I mean. Well, thank you so much, and thank you so much, Mengo Hospital, for always giving us this time to share with our viewer out there, and of course on pertinent insights like this particular one that we were looking at. So please take that child for examination so that you get it from the right people. There's a lot of information out there, and when you pay attention to that information, you're subjecting your eyes to bigger problems that you might never like in future. So get it from the right people. I mean, Mengo Hospital is here. The clinic is open Monday to Friday, 8 to 5. Yes, and then Saturday 8 to 2. Yeah, at least if you're busy, you work Monday to Friday, at least on a Saturday, pass by and know how your health, because when you lose sight, then what will you ever see? I mean, we do not want to think about what happens when you lose your sight. Anyway, thank you so much for watching today's coffee break. Edwin Austin Mukalazi is my name, sitting in for Rita Nandera. And Rita Nandera, we pray that God will comfort you and the entire family, and of course, plus all those who are going through challenging situations. But of course, from the entire team, Elizabeth, Liz, someone doesn't want to be called Elizabeth, but Liz, Esther, who also wants to be called the S, it is okay, Patience, and of course the entire team, we wish you a blessed morning.
This is Church of Uganda Family TV.